Hi, my name is Caitlin Franco, and I'm going to be sharing an anonymous story in first person of how a healthcare worker became a second victim. I'm going to start now. During my first few months of my job, our unit was presented with a priority 1, 3.5-year-old Jane Doe arriving by EMS that had drowned in an inch of water in a bucket after being unsupervised and was found non-responsive and alone upon EMS's arrival to the residence. For unknown reasons, EMS did not start life-saving CPR until arrival at the hospital, and an estimate of how long the patient had been unresponsive was unknown. Upon arrival to our facility, CPR was started immediately and was continued for over an hour in a result to save the child. While being in the trauma room with my first child that had presented unresponsive was emotionally traumatic, the second victim event did not occur until I had gone up to triage to continue my job. I was sitting at the front desk of triage when what appeared to be a distraught mother and father sprinted to the triage desk, and what the mother said next haunts me to this day. The mother looked at me with dread and pure pain in her eyes, filled with tears, as she asked, "Is my dead daughter in the back?" Trying to maintain my professionalism without succumbing to my emotions, I looked at the nurses around me, and they all looked at me with distraught looks, as no one knew what to respond. I guided the grieving mother and father to the back of the unit, to where the charge nurse and director were trying to obtain the needed information on the child, while being respectful and understanding of the loss. While the charge and director were with the grieving family, the mother began to cry out in emotional pain so loud the entire unit was aware, as horrified faces came from every angle from both the staff and patients, as the mother's grief was starting to set in. The entire unit went somber and silent as she cried out for her baby to come back. Tears filled my eyes and a heaviness filled my heart, as I have a younger sister who was not too far from the child's age at the time, and I began to think, what if it was my sister instead? To this day, I hear the wailing cries of what should never happen, a mother losing her child, and to this day it fills me with regret and pain knowing that there was not more I could have personally done to relieve the pain or bring the child back. This was my story of becoming a second victim, a sentinel event that altered my mentality. This is one of many stories from healthcare providers worldwide.